Hey, my name is Jeremy. In this episode, we're going to be going over ocular ultrasound. This is a nice tool to have for any acute vision loss. This can easily detect a vitreous detachment, a vitreous hemorrhage, or a retinal detachment, and also is a great tool to measure your optic nerve width to detect intracranial hypertension, and I'm going to show you guys how to use that on the ultrasound today.
Okay, so the first thing we want to do is apply a large tegaderm over the eye we are going to ultrasound, and we want to apply it medially to laterally and try to get the air bubbles out. And just remember to remove the tegaderm in the same manner to go with the grain of the eyebrow hair and not against it, so you're not pulling out eyebrow hair when you remove the tegaderm. And you want to add a copious amount of ultrasound gel over the eye, because this will be the medium for which you can see the eye on the ultrasound, and we won't be applying pressure to the actual eyeball. We'll just be moving it through the gel to visualize the eye. Ideally, you want to use the linear probe when you do this. This is the phased array probe in this example, and you always want to have the indicator pointed laterally. And what you want to do is you want to fan the probe up and down, left and right, have the patient move their eye up and down, and then switch the angle of the probe as shown here to get a full view of the eye. So this is your normal eye anatomy on ultrasound real quick. Okay, so here's the ultrasound of the eye, and you can see right there is our optic nerve, and we're going to show how to measure that in just a little bit. Other things that you can see on ultrasound are a retinal detachment. And the difference between a retinal detachment and a vitreous detachment is that in a retinal detachment, this line here is always anchored and tethered to the optic nerve. So you'll see here that that line is always anchored to that optic nerve and tethered. So that is a retinal detachment. A vitreous detachment does not have that. So just a quick, easy way to identify some quick eye pathology. And sometimes you have a vitreous hemorrhage that goes along with a retinal detachment and vice versa. So you can kind of see the swirling fluid collection, which would be a vitreous hemorrhage as well. And you're going to have the patient move their eye around to get better views of these things. And the last thing that we're going to check for is for elevated intracranial pressure. And certain pathology such as head injury, stroke, brain tumor, encephalitis, idiopathic, ICP, venous thrombosis, AV malformations, these all can cause increased intracranial pressure, and this is a quick screening tool to see if there's any potential intracranial pressure. So here we've identified the optic nerve, not the best image, but we're going to start measuring from the back of the retina and just measure at that mark right there and just adjust our other mark to be right at 3 millimeters. We're at 0.25, 0.3, perfect. So right there is 3 millimeters back. And now we just need to measure across, and we're trying to see if it's greater than 5 millimeters, which would be pathologic. So we're going to start to measure across the optic nerve here once I get my bearings. And we're just going to measure that left border of the optic nerve right at that 3 millimeter mark, and then just measure across. And we're seeing we're at about 0.44 centimeters or 0.45 millimeters or 4.5 millimeters, which is less than 5. So this patient had no symptoms, so rightfully so. There's no signs of any elevated intracranial pressure in this patient, and this is a negative exam. To be more accurate, you want to measure both the left and the right eye and then take the average of both of them and maybe even measure it twice for a good measure. And just be aware that there's different measurements in children. So the less than 5 applies to adults, and there's different measurements depending on how old the children are. So this is a great tool to utilize in the emergency room to detect certain eye pathology. It's quick and easy, and such a great resource to have and tool to have in your back pocket to use at any moment's notice. So you definitely want to make note of this and have this skill in your back pocket.
Thank you guys for watching, and stay tuned for more videos.